Imagine going to the doctor. Maybe you're in your 40s and you're dealing with some occasional constipation.
Right, something pretty common.
Exactly. But then you're told it's actually an early warning siren for a neurological movement disorder that you won't even develop until your 60s.
Yeah, it sounds like science fiction, honestly.
It really does. You just wouldn't expect a sluggish bowel movement to predict a hand tremor decades down the line. I mean, it's wild. But when we look at the landscape of Parkinson's disease, that is exactly what the data shows.
Yeah, the early warning system it isn't a change in how someone walks or some sudden rigidity in their hands. The warning sirens are actually going off in the gut.
Which completely forces a rethinking of how we view neurodegeneration. And for this deep dive, we are looking at a serious stack of sources today.
We really are. We've got clinical insights from the Inova Parkinson's and Movement Disorder Center, physical therapy strategies from Rogue PT.
Guidelines from the American Parkinson Disease Association, too.
Right, and diagnostic criteria from Practical Neurology, plus a pretty intense medical case report from Curious.
Yeah, that case report is wild. We'll get to that. But the common thread through all of this is that constipation isn't just some frustrating side effect for people with Parkinson's. I mean, it's often the opening act.
Exactly. According to the research in Practical Neurology, people who have fewer than one bowel movement a day, they actually have 3 times higher odds of developing motor Parkinson's later in life.
Okay, let's unpack this, because a 3 times higher risk is massive. But biologically, how does a traffic jam in your digestive tract decades earlier connect to the brain?
Right. It feels like a massive leap.
It does. It feels like we need a better mental model than just saying, they're linked. I like to think of it less like a sudden storm and more like a slow-moving electrical fire.
Oh, I like that analogy.
Yeah, like a fire that starts deep in the basement wiring of a house, and it's just smoldering for 20 years, right? Before it finally burns its way up the walls and shorts out the fuse box in the attic. And the attic is the brain.
That is a highly accurate way to visualize it. I mean, in the medical community, this mechanism is explained by the Brake hypothesis.
Right, Brake.
Yeah, the theory proposes that the core pathology of Parkinson's, which is basically the abnormal clumping of a misfolded protein called alpha-synuclein,
Right.
it doesn't spontaneously begin in the brain's motor centers. It actually originates in the enteric nervous system.
Which is the gut, right?
Exactly. It's this vastly complex, independent network of nerves embedded in the lining of your gastrointestinal tract.
A lot of people actually call it the second brain.
Because it does so much without us thinking about it.
Exactly. It governs everything your gut does automatically.
So in stage 1 of the disease, long before anyone notices a hand tremor, these alpha-synuclein proteins are already depositing in the gut's wiring.
Right. They're actively damaging the autonomic nerves that dictate peristalsis.
Peristalsis being that muscular wave that pushes food and waste through your system.
Right. So if the electrical signal is weakened by those proteins, the muscles just don't get the message to contract. Which leads directly to the 2 distinct types of constipation we see in Parkinson's, like the ones physical therapists, like those at Rogue PT, talk about.
Yeah, the first one is called slow transit constipation. And it's exactly what you just described.
Yeah.
The colon itself becomes sluggish because of that autonomic nerve damage.
The physical wave of muscle contraction just isn't happening with enough frequency or, force.
Yeah, it's like cars moving at 5 miles per hour on a highway.
Right. The road is clear, but the engines are failing.
Exactly. And then there's the second type, which Rogue PT calls outlet constipation, or pelvic floor dysfunction.
So staying with that traffic analogy, outlet constipation is like arriving at your exit, but the toll booth gate is stuck closed.
That's a great way to put it, because the pelvic floor muscles, they're supposed to relax in this highly coordinated way to let waste out.
But due to the neurological deficits of Parkinson's?
Right, those muscles often remain tight and uncoordinated during a bowel movement. What's fascinating here is the sheer scale of this hidden epidemic.
It's huge, right?
Massive. When you combine slow transit and outlet dysfunction, up to 85% of people with Parkinson's experience debilitating constipation.
Wow. 85%.
Yeah. Yet studies show only about 40% openly report it to their doctors.
Which means the hesitation to discuss bowel habits, which, let's be real, is an uncomfortable topic, means a massive portion of the patient population is just suffering in silence.
Absolutely.
I understand the stigma, I really do, but I want to look at the mechanics of this. If the physical nerves in the gut are actively being destroyed by these protein clumps, can a patient actually do anything about it?
That's the big question.
Right. Or are we just talking about fighting a completely lost cause against a progressive structural disease?
A lot of patients fall into that exact mindset. They feel resigned. They assume it's just a tragic, inevitable part of the disease.
Which makes sense.
It does, but looking at the extreme end of the spectrum shows why resignation is dangerous. Because ignoring the problem, assuming it's a lost cause, doesn't just leave you uncomfortable.
Right, it gets much worse.
Yeah, it leads to severe, life-threatening structural consequences across completely different organ systems. We are talking about clinical emergencies.
And that brings the curious case study into stark focus. Because honestly, reading this report was genuinely alarming.
It's intense.
Yeah, it details a 77-year-old female patient with advanced Parkinson's. She was wheelchair-bound, relying on 24-hour care, and she just kept ending up in the emergency room.
Right, with vomiting, generalized abdominal pain.
Then severe abdominal distension. Her stomach was visibly painfully swollen.
Yeah, and when the medical team finally imaged her abdomen, they found severe colonic dysmotility.
Which, in plain English, means the muscles in her colon had essentially given up trying to move anything forward.
Exactly, and this led to a massive fecal impaction. Her rectosigmoid colon, which is that final S-shaped curve of the large intestine just before the exit, it was incredibly dilated.
Just stretched far beyond its normal capacity.
Right, but the impaction wasn't even the only emergency.
This was the shocking part to me. Her colon had become so distended, so ballooned out, that it physically compressed her urinary tract.
Yeah, it was actually crushing her right ureter, which is the tube that carries urine from the kidney to the bladder.
Which led to right hydroread, so a swollen urinary tube, and hydronephrosis.
Right, and hydronephrosis literally means water inside the kidney.
Wow.
Because the dilated colon was pinching the ureter completely shut, the urine had nowhere to go. It backed up into the kidney, causing it to swell dangerously.
Because the anatomy of the pelvic cavity is tight, there isn't a lot of extra room in there.
None at all. So when one organ system fails and expands massively like that, it acts like a physical vice grip on the surrounding organs.
Which means she was at immediate risk for permanent kidney damage, systemic infection, or, sepsis.
Exactly. And the intervention was incredibly intense. The surgical and urology teams couldn't just give her a pill.
No, they had to use a rectal tube, perform manual disimpaction, and administer a series of tap water enemas. And they ultimately removed 2 pounds of stool from her colon.
2 pounds.
2 pounds. But the wild thing is, the moment they cleared that blockage, the external pressure on her urinary tract just vanished.
Yeah, the hydronephrosis resolved almost immediately.
It's incredible.
It's the ultimate cautionary tale. Proactive management isn't a luxury. It's a non-negotiable requirement.
Absolutely.
Because if you let slow transit and outlet dysfunction go unchecked, the mechanical buildup of waste will literally start breaking down your other organs.
And most people want to avoid that ER scenario at all costs, so the immediate instinct is to reach for a medication, right? To force the gut to move.
Of course. That's human nature.
But the sources highlight a massive medication paradox here. The American Parkinson Disease Association guidelines provide a pretty sobering list of medications that actually cause or severely worsen constipation.
It's a brutal catch-22. Many of the first-line therapies meant to help Parkinson's motor symptoms are actually the worst offenders for the gut.
Yeah, drugs like Artane and Cogentin.
Right.
And we need to look at why that happens. These drugs are anticholinergics. Their whole job is to block acetylcholine, which is a neurotransmitter in the brain that gets overactive in Parkinson's and contributes to tremors.
But acetylcholine is also the primary chemical messenger in your autonomic nervous system that tells your gut muscles to contract.
It's the rest and digest chemical.
Exactly. So when you block it to stop a tremor in your hand, you are simultaneously paralyzing the smooth muscle in your colon.
You're sacrificing gut motility for motor control.
You really are.
Yeah.
This raises an important question, though, because the list doesn't stop at Parkinson's medications.
Oh, right. It includes narcotic pain medications, antacids containing aluminum or calcium,
Antihistamines like Benadryl, certain antidepressants, and even blood pressure medications like clonidine.
It's like trying to put out a fire in your kitchen with a fire hose, only to realize you're accidentally flooding your basement.
That's a great analogy.
The very thing solving one crisis is creating another. So if a patient is trapped in this paradox, what are the actual evidence-based medical interventions for the gut?
Well, doctors have to thread the needle carefully. For the slow transit type of constipation, the medical guidelines point to specific compounds that don't rely on stimulating those damaged nerves.
Like what?
Polyethylene glycol, which most people know as Miralax, is a primary choice, along with a prescription drug called lubiprostone.
Okay, so how does Miralax work if it's not stimulating the nerves?
It's an osmotic laxative. Instead of irritating the bowel to force a contraction, it simply draws water from the surrounding tissues into the colon.
Ah, okay.
Yeah, it softens the stool and increases its volume, which naturally stretches the bowel wall. That gentle stretching is often enough to trigger whatever reflex remains without relying heavily on the compromised nervous system.
Okay, but what if the problem is outlet constipation? You know, the stuck toll booth scenario where the pelvic floor muscles just won't relax? Miralax isn't going to fix a muscle spasm at the exit, right?
Right, it won't. That requires a targeted neuromuscular approach. Because the issue is muscle rigidity, doctors might use injections of fast-acting Parkinson's medications like apomorphine directly into the system to briefly improve motor function right when the patient needs to go.
Oh, wow, just a temporary boost.
Exactly. And in more severe cases, they actually use botulinum toxin ABOs.
Wait, Botox? For constipation?
Yeah, they inject it right into the puborectalis muscle. Botox works by blocking the nerve signals that tell the muscle to contract, essentially forcing it into a relaxed state so the toll booth gate stays open.
That is brilliant.
It really is. There's also non-pharmacological biofeedback therapy. That uses sensors to help the patient visually see their muscle contractions on a screen, retraining them to coordinate those pelvic floor muscles during a bowel movement.
Okay, using Botox to force the pelvic floor to relax is amazing. But medications and injections are still a double-edged sword, and they can lose efficacy over time.
That's very true.
Which brings us to a really powerful ethos we found from the European Parkinson Therapy Center. Their core philosophy is never give up and find solutions from around the world.
I love that approach.
Me too. Because constipation will affect almost everyone with this disease, from mild daily annoyance to the severe impaction we discussed. So we have to look globally and practically. Beyond the pharmacy, what mechanical and natural hacks actually exist?
Well, the mechanical fixes are where we start seeing immediate drug-free results. Rogue physical therapy emphasizes that our modern standard toilets actually create anatomical strain.
Yeah, sitting at a 90-degree angle kinks the lower bowel.
Exactly. The solution is just elevating your knees above your hips.
By using a footstool or a squatty potty.
Right. When you sit normally, that puborectalis muscle we mentioned earlier acts like a sling around your rectum, pulling it tight to maintain continence.
Okay.
By elevating the knees into a squatting position, you mechanically relax that muscle sling. It straightens the anorectal angle, creating a vertical chute instead of a bent pipe.
So you don't have to push. You let gravity do the work.
Exactly. Rogue PT also recommends colon massage to physically move the waist.
Oh, how does that work?
You lie on your back, apply moderate pressure, and move your hand in a slow, clockwise circle starting from the lower right side of your abdomen. You're basically tracing the natural ascending, transverse, descending path of the large intestine.
It's an elegant workaround. You aren't curing the nerve damage caused by alpha-synuclein, but you are optimizing the plumbing that remains.
Yeah, you're reducing the friction so those weakened muscles don't have to work as hard.
Here's where it gets really interesting, though. The dietary solutions. We aren't just giving the generic eat more salads advice here.
No, definitely not.
The Inova Parkinson's and Movement Disorder Center gathered specific, tested recipes from their patient community.
Which is great because community-sourced remedies are invaluable. They've been pressure tested by people navigating the realities of a sluggish gut every single day.
Yes. The first one is called the Not-So-Secret Recipe. It is 1 part applesauce, 1 part bran, cereal-like unprocessed wheat bran, and 1 part prune juice.
Okay, sounds simple.
It is. You mix it up, keep it in a container in the fridge, and eat just 1 or 2 tablespoons every morning.
Nice.
Then there's Ellen's Constipation Cure. This came from a patient who was taking massive doses of Metamucil and chemical stool softeners with absolutely no success.
That sounds awful.
Right. But a physical therapist told her to eat 2 rounded tablespoons of high-fiber canned pumpkin at breakfast.
Pumpkin. Pumpkin is an incredible intervention because it provides a dense source of soluble fiber.
And soluble fiber acts differently than normal fiber, right?
Yeah, unlike insoluble fiber, which just adds roughage, soluble fiber absorbs water in the gut and turns into a thick, gel-like substance.
Oh, interesting.
That gel coats the stool, making it slippery and significantly easier to pass without relying on harsh chemical stimulants.
It worked so well for that patient that she dropped her other laxatives entirely. I know. And there is also a recipe for constipation paste. You take a pound of prunes, a pound of raisins, a pound of figs, some brown sugar, lemon juice, and senna tea.
That is a powerhouse combination.
You boil it all down and puree it into a paste that you can spread on toast. And we actually need to look at why this works biologically.
Well, the senna tea is key there. Senna contains compounds called senosides. When they reach the colon, your gut bacteria break them down into a mild irritant that stimulates the mucosal lining, forcing a peristaltic wave.
Oh, so it forces the contraction. And the prunes in that paste provide a dual mechanism, right?
Exactly. They contain fiber, of course, but they also contain high levels of sorbitol.
Right, sorbitol.
Yeah, it's a natural sugar alcohol that the human body absorbs very poorly. Because it stays in the digestive tract, it has a powerful osmotic effect, much like Miralax.
So pulls water from the surrounding tissues into the colon, softening the waste.
You got it.
Then you add probiotics into the mix. The APDA notes that specific bacterial strains like Bifidobacterium and Lactobacillus can be highly beneficial for Parkinson's patients.
Dosing is critical here, though. Preliminary studies indicate these probiotics are most effective when taken daily at doses of at least 1 billion colony-forming units, or CFU, for a minimum of 2 weeks.
1 billion CFU, okay.
Yeah, because you are actively trying to repopulate the gut microbiome with bacteria that naturally produce short-chain fatty acids. Those help regulate bowel motility and reduce localized inflammation.
So we have looked at the 20-year root cause, the extreme dangers of ignoring it, the medication paradox, and these brilliant hacks from around the world.
We've covered a lot.
We have. Now, in the spirit of the European Parkinson Therapy Center, we need to synthesize all of this into a simple daily routine. Because you can't just try a random recipe once a week and hope for the best.
No, a piecemeal approach will fail against a progressive neurological condition. You need a structured, daily regimen. If we connect this to the bigger picture, pulling from Dr. Mick Reedy's clinical guidelines at Innova and the APDA framework, we can build a highly specific schedule. And it begins the second you wake up.
Morning hydration.
Morning hydration is the first pillar. You want to front-load your fluids, starting with warm liquids to stimulate the gastrocolic reflex. The absolute non-negotiable target is 64 ounces of water daily, roughly 6 to 8 glasses.
Warm liquid makes a lot of sense. It's a gentle thermal trigger for the digestive tract to wake up. And then breakfast needs to be highly regimented too, right?
Yes. Consistency trains the body's circadian rhythm. Eat breakfast at the exact same time every morning. This is the moment to deploy the dietary hacks.
Mix in the 2 tablespoons of canned pumpkin or have your spoonful of the applesauce bran prune paste.
Exactly.
And the overall fiber target for the day.
The goal is 20 to 35 grams of fiber per day, sourced from whole foods like lentils, sweet potatoes, beans, or bran cereals. But, and there's a massive caveat from the EPDA here, you must ramp up your fiber intake slowly. Add no more than 5 grams a week until you reach that 20 to 35 gram threshold.
Okay, I want to pause and push back on this routine for a second because we need to address the reality of living with Parkinson's.
Fair.
The average American diet only has about 15 grams of fiber. Jumping to 35 grams, drinking 64 ounces of water, adhering to a strict bathroom schedule, managing medications. I mean, this sounds like a full-time job.
It is a lot of work.
For someone already dealing with profound physical fatigue, tremors, and cognitive load, is this actually feasible? And frankly, if someone is exhausted and decides to just take a massive scoop of psyllium husk fiber but forgets to drink their 64 ounces of water, aren't they making the problem worse?
They are making it exponentially worse. Taking bulk-forming fiber without adequate hydration is the equivalent of pouring dry cement mix into a clogged pipe.
Oh, man. Dry cement.
Yeah. It will cause severe cramping, severe bloating, and can precipitate the exact type of bowel obstruction we saw in the Curious case study. Fiber and water are an inseparable partnership.
So they have to be done together.
Always. But your pushback is incredibly valid. The cognitive and physical burden is high. That is precisely why the routine must be automated.
What do you mean by automated?
You don't try to remember to drink water. You fill a 64-ounce jug every morning and keep it in your sightline. You don't guess your fiber. You eat the exact same engineered breakfast every day to remove the decision fatigue.
Ah, I see. You streamline it to protect your energy. What about physical movement?
Cardiovascular exercise is the final pillar. A daily brisk walk physically bounces the organs and stimulates peristalsis.
Just getting things moving mechanically.
Exactly. Pair that with diaphragmatic breathing, deep belly breaths, and the pelvic floor exercises to maintain whatever coordination remains. Finally, you establish a fixed time every single day to sit on the toilet with your feet elevated on a stool.
And the golden rule from the APDA.
Never, under any circumstances, ignore or delay the urge to have a bowel movement. If your body signals that it's time, You drop whatever you're doing and go.
So, what does this all mean? Constipation in Parkinson's disease will affect almost everyone. It ranges from mild daily annoyance to severe medical crisis.
It's a huge spectrum.
It is. The nerve damage caused by alpha-synuclein is real, and the structural complexities are profound. But you are absolutely not powerless.
Yeah.
You don't have to accept this as an inevitable tragic consequence of the disease.
Not at all.
By combining aggressive, measured hydration, timed fiber intake, mechanical posture changes, and targeted medical support when needed, this is entirely manageable. We have solutions from around the world. You have the tools to keep the traffic moving.
It requires vigilance, but the tools work. As we conclude today, I want to leave you with a thought to consider, circling all the way back to the break hypothesis we started with. We established that the alpha-synuclein protein clumps that eventually cause the severe motor symptoms of Parkinson's actually begin in the gut, up to 20 years earlier. If that pathway is true, if the disease physically travels from the enteric nervous system up the vagus nerve and into the brain, could the future of Parkinson's treatment lie not in treating the brain at all, but in radically fixing the gut microbiome before the disease ever has the chance to travel upward?
Wow, that is a staggering possibility. Imagine putting out the electrical fire in a basement decades before it ever threatens the attic.
It changes everything.
It really does. Well, thank you so much for joining us on this deep dive. Take these tools, build that automated daily routine, and as always, keep learning and stay curious.